So now I want to introduce the star of the show. So Dr. Ken Brown and his friend Angela. So Ken and I graduated from med school together, and actually we were roommates. So I know all the dirt on Ken and vice versa.
Hey, Linda, we're having a hard time hearing. Can we have everybody else mute so that, because you're being drowned out by a lot of background noise.
Oh, it might be that coffee shop too.
It might be. Yeah, it might be you're the one that needs to mute.
Yes. So Ken and I have been very close. He's like a brother to me. He's very accomplished. He's not only a physician, but after med school, he ended up going to Texas, where he is now. He spent some time as a male model for J. Crew. He's a former astronaut, and he's a two-time Iron Chef winner. So this is just so lucky to have Kenny here with us today. Take it away, Ken.
Yeah, so you may have exaggerated a little bit on those accomplishments. I want to clarify. I was only a one-time Iron Chef winner. I was runner-up the second time, so it seems a little exaggerated right there. I do want to introduce Angela Cook. So Angie is a patient that became a friend and is now quickly becoming a colleague. She is a registered nurse, and while I've known her, she's gone on and got her master's degree in nutrition, and she is a phenomenal researcher and able to gather information like nobody I've ever met. Would you like to introduce and say anything else?
I just want to say hello, everyone. Oh, sorry. I'm new to this. Hello and good morning. I'm really glad to be here. When Dr. Brown asked me to come, I quickly got on the internet and read up about your organization. I watched your videos. I can see that you guys are a really special group, and it's just an inspiration to see, Dr. Snyder, what you've done. And I'm really honored to be here. Thank you for letting me come and be part of this group today.
Are we good? Everybody seeing it?
I believe so.
Looks good. Looks good.
Do we need to let Kent's iPad enter the waiting room? I'm host. That's me. I have to do that. There we go.
Please, yes.
All right. Well, as Angie said, everyone, thank you so much for letting us come here today. We wanted to talk about ataxia and the gut-brain connection. This is a PowerPoint that predominantly Angie's going to talk about, and she's got some reasons behind this. Not only does she have a master's in nutrition, but she herself has struggled with some dysautonomia issues, and we're going to get into how that relates. But because of that, I feel like we have found some things, and I talked to Linda about this, that may help everyone in this group. And this may be old news because your doctors may have discussed it. Hopefully you will get something new out of this. So anything to begin, Angie?
No, I'll let you start.
All right.
I'll share a little bit more about my story as we get into it.
So let's start with this. All right. The remote's not working. All right. So, University of Nebraska Medical Center, 1994, what was happening was Linda and I initially met during our gross anatomy. Gross anatomy is the first class that you take when you are in medical school. She was randomly assigned to our table, or we shared a cadaver where we learned the anatomy. So we're about a month or 2 months into our anatomy, and I'm going to minimize that. We're about a month or 2 months into the anatomy class, and Linda showed up and she was crying. And I said, well, what's going on? Why are you upset? And she's like, well, the University of Minnesota contacted me, and they have asked if I could come up there, and they want to run tests on me because my father died of a disease called ataxia, and they are studying my family because it's genetic. And I was like, wow, that is pretty heavy stuff to be handling at 23 years old. What are they going to do? And she's like, I don't know, but I really feel like I need to go and help in any way that I can. And so I'm like, well, there's no way you're going up alone. So Linda and I drove. I don't know what's going on with the Zoom, but it's not
I
working.
just want to say I was 21,
Oh, you're 21.
not 23.
So I told Linda that I would go with her to Minnesota. So we drove up there. And what she did was nothing short of extraordinary, because she allowed these researchers to poke, prod, put her through a lot of painful tests, including nerve conduction studies, sweat tests, all different kinds of things, lots of blood draws, strictly to help everybody else that has ataxia. And that's why I'm going to refer to Linda during this intro as the beautiful mouse Linda, because she basically gave herself up to science for those few days that we were there and allowed them to do just about anything that they wanted. And once again, some of those tests were actually really painful. And while we were there, and I was with her the whole time, watching all these things go down. And while we were there, a researcher came and said, "Hey, do you want to come down and see the mouse lab?" And he said, "We've got your genetic sequencing. In fact, we've been able to show your GC repeat in this mouse." And I'm going to refer to this mouse as the mouse called Linda, not the beautiful mouse Linda. And at 21 years old, he is pointing to a mouse called Linda, and the mouse couldn't move. And she's looking at this, and he, unknowingly, not realizing that he's a bench researcher, said, "Well, we believe that this mouse is somewhere between 35 to 45 years old." Essentially telling Linda, the beautiful mouse Linda, that she has a good chance of not being able to move. And so the mouse called Linda, after we went back to the hotel and wrapped our brains around that, or she had to wrap her brain around that, and then ultimately got through med school and did amazing, was initially going to be a pediatrician, but because of the mouse called Linda, she had to make some life decisions. And one of the life decisions was that she wanted to be a pediatrician, but she realized that if she was going to have mobility issues, she chose to become a radiologist. And because of the mouse called Linda, the beautiful mouse Linda became one of the most accomplished breast imaging people in the country. And because of the mouse called Linda, she has saved thousands and thousands of lives and found early breast cancer in people. And while she was doing that, she said, "Well, I better do a whole bunch of cool things." And she traveled the world and saw all kinds of beautiful places. And every time she would call me from a place, she would describe it and send pictures. And she even went to Zihuatanejo, Mexico. And I remember that distinctly because she went there because of Shawshank Redemption. So the beautiful mouse Linda did these amazing things. But there was more to life. And she discovered her why not too long ago. And her why was to, number one, make sure that she was surrounded by loving people and have the social bonds. And so her why was that she found love and she developed purpose. So reading some news articles of Linda over the last 5 years and how she's describing herself being the happiest that she's ever been, even though that her ataxia is starting to show up, she has love and purpose, and she discovered her why. So I've always discussed that my why is to try and protect the brain through the gut. And that's one of the reasons why I feel like Angie and I hopefully can bring a little bit to this. But I wanted everybody in the group to understand Linda's story and where it came from. And really, she made these huge life decisions based on a mouse called Linda. And she's saving lives, not just through being a doctor, but by her and Skippy starting the Nebraska Ataxia Society and helping people out. So that's what I wanted everybody in the group to understand. So now let's do the talk. Ataxia. Ataxia is the umbrella term. So whether you have, I love that when everybody introduced themselves, they were discussing what type of ataxia they have. Because whether you have Friedreich's ataxia or spinocerebellar, one of the genetic ones, or even episodic or even gluten ataxia, there's one common theme here, and it is that there's cerebellar issues going on, which creates the ataxia. So anything that we discuss here that is good for the brain is going to be good for the cerebellum. Remember that the cerebellum is only 20% volume of the brain, but it is 50%, it holds 50% of the neurons. So people underestimate how important the cerebellum is, considering that 50% of the neurons are in the brain. It only has 10% of the total volume. All right, so I'm a gastroenterologist, which means that I'm a gut doctor. Now, my primary research was in irritable bowel syndrome. Now, irritable bowel syndrome is a trash can term. Much like I just said that the umbrella was over ataxia, and there's lots of different mechanisms. IBS, a lot of doctors will just say you have IBS, but meeting with researchers, we have now since discovered that irritable bowel syndrome was actually caused by bacteria. And it's not just that bacteria are good or bad, it's that bacteria happen to be growing in the wrong place. Now, I bring this up to this group because I have reviewed some literature that has shown that people with ataxia can actually be at higher risk of having this situation. They're at higher risk of having intestinal issues. And we call this bacterial overgrowth. Now, this is really important because we are learning that this gut inflammation or this gut process is a domino effect that can do all different kinds of things. So what happens is the bacteria get in your intestines, and then when you eat, the bacteria break down the food before you can. And so they produce gas. The gases make you feel bad, and they cause bloating, constipation, and diarrhea. But we now know that it creates inflammation. And this is the key to everything here. So it's the inflammation that starts a lot of different processes. Specifically, it can lead to something called leaky gut. Doctors won't use that term. They'll use something called intestinal permeability, but it is leaky gut. And really what that is your cells are really tightly bound and your body works very hard to control inflammation. But when your gut isn't working properly, then this inflammation actually leads to your body's ability to sample the outside world. And it's almost like sheep going through a fence, if you think of it that way. Your barrier has been compromised. So what this can lead to is not just inflammation. That's just the beginning. Once the inflammation starts, it looks like almost all autoimmune diseases can be turned on, and including thyroid issues, which is super common, and it can lead to all different other kinds of symptoms like depression or sleep issues, chronic pain. It can lead to heart disease and liver disease. So this is just the beginning of what can actually happen, which is why it's so important to protect your gut. In fact, since 2004, Time did a whole special on this where they said that's a surprising link to with inflammation to all these other problems. It's been since 2004, and people are now just starting to talk about it. That barrier that I was talking about on this busy slide, here's the really important thing, that once you start having all this inflammation take place, well, there's a certain cell called a mast cell that then sends a signal to the nerves, and then the nerves send a signal to another nerve called the vagus nerve, which is the highway. And what happens with that is that is our link between the gut and the brain. So this is why the gut-brain axis is so important. And you really can't heal your brain unless your gut is working well. And that's where I'm going to bring in my expert, Angie, and she is going to take it from here. Do you want to see them, or do you want to?
That's fine.
Like that?
Yeah, that's good.
Okay.
Okay. So before I get started, I just wanted to share a little bit more about my background. I am a patient of Dr. Brown's. That's how I met him. Been a patient for about going on 9 years now. I actually was on his podcast last year. So I talked a lot about my story and my history, and I'm not going to go into all the details. But basically, I had primarily a problem with my colon that is called colonic inertia. And basically what that means is that your colon pretty much is paralyzed. All the nerves and the muscles that are necessary for your colon to be able to function just don't work very well. And that's a big issue because your colon is the last part of your digestive tract, and its responsibility is to help get all of the waste through so that you can eliminate that. And if you're not able to eliminate it, then you can have all kinds of different issues. So when I met Dr. Brown as a patient, this was my first problem, and it was a problem that had come on pretty suddenly. For me, what we found through the years is that it's very likely related to an issue that I had in my spinal cord and my neck. I later found out that I had some discs that were a problem, including a disc that was pressed about halfway through the spinal cord. And that had actually caused not just problems with my colon, but I actually was starting to have problems walking and all kinds of other issues as well. So I say all of that just to say that in my years that I was Dr. Brown's patient, I actually still am your patient. We tried really hard to manage all of this medically. I tried to take a lot of different medications and do a lot of different things to make my colon work. But as the years progressed, all of those efforts failed. So about a year and a half ago, I actually had to go ahead and have my colon removed. And through the years that I was trying to manage all of this medically, a lot of other things started happening, which I'm going to kind of get into as we go through the presentation. But a lot of them are symptoms of what we call dysautonomia. And I sort of just put all of that in one bucket. And I thought, this is all because I have colonic inertia. And I kind of thought in my mind that when the colon was gone, that all of these other symptoms that I had going on were also going to get better. And what I found out is about a year and a half ago when I had my surgery, the colon problem got better, but all my other problems still continued. And I was really kind of disappointed and didn't understand why. And that's what really prompted me to learn more about what was happening. And it kind of led me down this path of the gut brain connection. And we're going to talk about the vagus nerve and all the things that we're going to get into in the next few slides. So the only reason I say all of that is because I know that everyone here has ataxia, and ataxia in just that word is just a symptom. It's like an umbrella term, and it means that you have problems with the voluntary movement of your muscle. And all of you have different causes. Some are genetic, sometimes it's acquired, but it's just important because you probably have a lot of other symptoms as well. And you may be like me, where you're just lumping all of that and saying, this is my ataxia. And for me, what I found is that there were several things going on. And once I realized that, then I was able to kind of put the pieces together and learn some things that might help me better control some of my symptoms. Okay. All right. The next slide here, all health begins and ends in the gut. And Dr. Brown says this all the time. This is really true. The reason I have this here is because we're going to talk a lot about how that works and how that's important to ataxia. Okay, this is the gut-brain connection, and gut-brain connection is kind of a buzzword. You hear it a lot now. There's articles, it's in the news, you've probably all heard of it, but it's really more than a buzzword. As Dr. Brown said, everything that's happening in our gut can affect our brain. And the way that that happens is through the vagus nerve. So we're going to talk more about that. I put this slide in here because this really was kind of an aha moment for me. I was reading a book, which I'll share at the end, but it's called Why Isn't My Brain Working? And the author really described brain fog as being a symptom of your brain trying to tell you that there was some inflammation happening. So we all know that when you get a cut or if you sprain your ankle, you start to see signs of inflammation. You can see redness and swelling, and it hurts. And so that part of the body is telling you, hey, there's something going on. I'm hurt. There's inflammation. But in the brain, you really can't always see that. Brain fog is something that I think is very common. I know I struggle with it. I know Dr. Brown says a lot of times when he sees patients, they'll come and they'll be all focused on everything happening in the digestive system. And he'll stop and say, hey, do you ever feel like you're losing your train of thought or you're having trouble concentrating? And what do they say? They say
they're
yes.
like, oh my gosh, why? Why did you even ask that? Because yes.
Yes. So I put this in here just to kind of share. It was an aha moment for me that brain fog is really kind of your brain telling you that it's inflamed. Okay, this is a diagram of the brain, and there's just a couple parts here that I wanted to point out. It shows the cerebellum, and it's at the base of the brain, and then the brainstem. And the brainstem is right next to the cerebellum. What you can't see is that the brainstem is actually starting the spinal cord. So this is where all of the nerves come into the brain. And we're going to talk about the vagus nerve next, but this is where the vagus nerve comes into the brainstem and how it connects to the brain. Okay. So we're going to talk a lot about the vagus nerve, and I'm going to just tell you, I'm a nurse. I've been a nurse for a while. I don't remember learning a whole lot about the vagus nerve when I was in nursing school, other than that it's part of our cranial nerves. It's actually the 10th cranial nerve. And vagus actually comes from a word that's Latin that means wandering. And as you can see in this diagram, everything that you see that is yellow is part of the vagus nerve. It starts in the brain, but it actually goes through the core, it goes through the trunk, and it actually has all these little branches. So it's not just one straight line, but it actually branches off into all these different parts. And it really goes to all your internal organs. It goes to your heart, it goes to your lungs, it goes to your digestive tract. So you can see why it's called the wandering nerve. The vagus nerve is actually the main nerve that controls our autonomic nervous system, which is what we're going to talk about on the next slide. So the autonomic nervous system is the part of our nervous system that does everything in our body that we don't have to think about. So your body has a lot of different things that happen: digestion, breathing, your heart beating. We don't have to think about that for it to happen. It just, the body knows to do it. And the autonomic nervous system is actually divided into three parts. It's the sympathetic, the parasympathetic, and the enteric. And you don't have to remember those names. I actually will say I used to get those all confused with the sympathetic and the parasympathetic. But if you just think about what they do, the sympathetic is the part of your nervous system that kicks in. It's called the fight or flight response. So when they're teaching it in school, they'll say, think about being chased by a tiger, how your body just takes all its energy and it focuses on getting away from the stress. And it doesn't have to be a tiger, it can be any kind of stress, but that's the part in your body that reacts to stress. Then the parasympathetic is called the rest and digest. And that's the part of the nervous system that helps you just calm down, relax. It's when everything is able to kind of work ideally with your breathing and your heart rate and your digestion. So it's the part that helps us to rest and digest. The enteric nervous system is actually the part of the nervous system that controls the digestive system. And this is actually probably a little bit new concept, that the enteric nervous system is considered part of the autonomic nervous system. But I think that's because we're beginning to realize how important the gut is to everything that's going on. So all of that information in the gut is actually being transmitted to the brain, and it really has an impact on everything happening in our nervous system. This is just another slide to kind of reinforce, remembering that with the autonomic nervous system, it's really everything in our body that helps us react to stress. And it also helps us to just kind of relax and calm down and get our rest. Okay, this is another slide that shows the vagus nerve. So the vagus nerve is the yellow line that's going down the middle of the body. And this just kind of gives us an overview of some of the functions that the vagus nerve is responsible for. So of course, the most important is that it conveys information from the organs to the brain, but it also helps with our speech. It helps with making sure we know how to digest, how we we can swallow our food, and then in our stomach and our intestines, it tells our organs what to do. It helps control our heart rate and our blood pressure. So it really controls all of the things happening in our core and all of our internal organs.
I just want to comment on this. When Angie was sending me these articles, this really just kind of hit me regarding ataxia, that I did not see a whole lot of articles, at least scholarly articles, discussing how to improve the function of the vagus nerve to help with ataxia. And if you look at responsible for speech muscles, controls throat muscles, and directly affects the cerebellum, this is why I think some of this background in the science is so important. And we're going to tell you later how to sort of improve that process.
Okay, this is a really cool graphic that Dr. Brown helped make, and we wanted the message here that we wanted to share is that here we're seeing the vagus nerve again, right? So all of the yellow lines, this is all the vagus nerve. And then you see two arrows. There's an arrow that is going from the organs up to the brain, and it's a bigger arrow, and it's 80%. And that means that there's 80% of the information that the vagus nerve transmits. It's information that is going from our organs to our brain. So it's information that our organs are telling our brain about what's happening in our body. Then the smaller arrow is going down, and that's only 20%. And that is representing that the vagus nerve really only, of the information that it transmits, only 20% of that information is what the vagus nerve is sending to the organs. So if you stop and think about that for a moment, we just talked about all the important things that the vagus nerve regulates. It helps to control our autonomic nervous system, which is our breathing and our heart rate and our digestion. We need all of those functions to survive. Those are all very vital functions. But that information that it's sending to tell the organs how to do all that is only 20% of its job. 80% of that information that it transmits is actually what the rest of the body is telling the brain about what's happening in the body. Okay, so we're going to talk a little bit about acetylcholine. We're actually going to talk a lot about acetylcholine. So acetylcholine is a neurotransmitter, and it's the primary neurotransmitter that you need for your vagus nerve to function. And it's a chemical that our body makes. It's not something that we can take in a supplement or a bottle, although we are going to talk about some supplements that can help increase your acetylcholine. But really, your body has to be able to make it for itself. So you need to have the right nutrients. And many factors can affect our acetylcholine levels. These are including diet and lifestyle. So everything that's happening with our diet and our lifestyle could affect whether or not our body has the right nutrients to make the acetylcholine. I learned about acetylcholine because, as I shared, I had problems with my colon and the way that my colon moved. And acetylcholine is very important in the colon, really for your whole digestive tract. It is it is the neurotransmitter that your digestive tract needs in order to stimulate movement. But it's also important for ataxia because, just like the movement in your digestive tract, acetylcholine is the primary neurotransmitter that you need to be able to move your muscles and your nerves throughout your whole body. So again, we're just stating again, acetylcholine is the same neurotransmitter that you need for digestion as well as for movement. Okay, we're going to talk now. We talked about the autonomic nervous system and how important it is and how the vagus nerve controls that autonomic nervous system. But one of the other really important jobs, most important jobs of the vagus nerve is to control inflammation. And again, this is not something that I learned in nursing school or probably that Dr. Brown or Dr. Snyder learned. This is all pretty new science in the last 10 or 20 years. And this is really, really, when I started researching, this was like just such an aha moment. And when I first started coming across articles and research and books, and they were talking about the vagus nerve and inflammation, it wasn't really intuitive to me. I didn't really understand the connection. But the more I got into it and the more I learned about how all of this works together, the more it was kind of like an aha. And I'm like, oh my goodness, now I'm understanding not only how the vagus nerve controls inflammation, but why everything that was going on with me was I was starting to have all these other symptoms that had developed over time. Okay, this is a really geeky science slide, so I'm going to take some time to try to walk through it. Um, if anyone has any questions, feel free to unmute yourself and stop me. So I put some bullet points on the left. I know that you guys tape these talks and you might want to come back and look at it. But for right now, look at the diagram on the right and we're going to explain it and talk about it. So you see at the top, there's the vagus nerve and then there's the macrophage. Those are the two gray circles. So the vagus nerve is in the brain and the macrophage, or some people call it the macrophage, that's an immune cell. That's one of our white blood cells that is in our body. Did you have something you wanted?
No.
Okay. So your macrophage, you have them all throughout your body and every organ. It's just part of your white blood cells. So the macrophage, what happens is that anytime your body is attacked, if it has an injury, then that macrophage gets stimulated and it turns on and it says, okay, now it's time to do my job. And it sets in motion several things that happen. But at the end of the game, what it does is it actually creates inflammation. So again, if you think about those examples, like if you cut yourself or if you sprain your ankle, that's the macrophage that's saying, wait a minute, there's an injury. We've got to do something about it. So it sets in motion this path and it sends inflammation to the site of the injury. But like Dr. Brown said at the beginning, there's a lot of inflammation that's happening in our body that we don't always see. And that's what we're finding out is the cause of a lot of chronic illnesses. We have a lot of ongoing, persistent, chronic inflammation just all throughout our body that we don't even recognize. We kind of get accustomed to it. We think that it's just because we're tired or that we're getting older, we're having more symptoms, but that inflammation is what is driving a lot of the chronic disease. So what is happening is that the vagus nerve, its job again is to help control inflammation. So the way that it works is with acetylcholine. So you can see that arrow coming from the vagus nerve down, that is the vagus nerve that is sending the acetylcholine. It's sending the message to release acetylcholine. And acetylcholine, again, is a neurotransmitter, and its job is to help control inflammation. And the way it works is that there is a receptor on every macrophage cell. And a receptor is kind of like this little place on the cell that it has a very specific job. And this particular receptor, its only job is to wait for the acetylcholine to land on it. And once that acetylcholine lands on that receptor, then that receptor says, okay, wait a minute, there's a lot going on here. I need to kind of take control of the situation. I need to see what's happening with the inflammation. And it's kind of like it starts to direct the process. So it kind of oversees that whole event that's causing the inflammation. And it's basically going to tell the macrophage, okay, we've got enough inflammation to take care of the injury. We need to turn off the inflammation. So it stops that macrophage from creating ongoing inflammation that becomes that chronic inflammation that can lead to all those other problems. So basically, again, you've got the vagus nerve sending the acetylcholine. It is going to tell the macrophage to stop with the inflammation. It's kind of a smart mechanism to help oversee that whole process. And then when that's working right, it's going to stop the chronic inflammation. That receptor actually has a really long name, and that's over in the bullet points. And you'll see it's alpha 7 nicotinic acetylcholine receptor. It's really long. You don't have to remember it. I'm just calling it out because you're going to see that name on another slide. But that's the name of the receptor that we're talking about, that little yellow box there. How'd I do?
You did fantastic.
Okay.
Now this is really important. And I think that what I like to do with my patients is I like to actually draw stuff like this out so that when we do have an action plan and when we're going to say, this is why you should lead this lifestyle, this is why you should take these supplements, it's to improve this diagram. So even if you're like, well, I don't really cut myself or sprain, that's not a big deal. No, but when in my world, when you go to McDonald's and you eat a very processed meal and you digest in that processed meal high fructose corn syrup, polyunsaturated fatty acids, and emulsifiers, that actually damages the intestinal lining, turns on that macrophage, which then sends a signal to the vagus nerve and increases neuroinflammation. If you don't have enough acetylcholine so that the vagus nerve sending that message back, 20%, 80% of the macrophage is sending information. The vagus nerve sends 20% and says, hold on, this person is eating. It's not really an attack, but the body views it as an attack. So inflammation starting in the gut appears to be one of the silent killers.
Okay. So now we know that it's really important that we want our vagus nerve to function correctly. So you might want to know, like, well, how does the vagus nerve not function correctly? So again, it's all about the acetylcholine and well, let me back up. So the vagus nerve, one cause of vagus nerve dysfunction can be direct injury. So that can happen if you had an injury to the nerve, if you had surgery, if you had radiation. That's really not very common. I don't think probably anyone here has probably had that. The most common cause is chronic inflammation. And the reason that that's the most common cause is because that chronic inflammation can deplete your acetylcholine and then turn on that process that we just talked about and keep it going. Okay, so chronic inflammation can be caused by a lot of things. It can be infection, illness, stress, antibiotics, lack of sleep, poor diet, all of those things that happen. It might be something where you are sick, and yes, that creates inflammation. It could be just that you have poor sleep or that you're really stressed out because you're going through an event. All of those things can cause what your body perceives as inflammation.
So Linda, that's why I asked you that question. Do you find your ataxia, do you find your symptoms of ataxia to get better or worse during certain situations? And your response was lack of sleep. I find it to be worse, and significant stress. And here's why. Now we have a reason. When you don't sleep, this is actually why your ataxia can get worse. It's due to this inflammation.
Okay, so the next slide is just a journal article. And the reason I included this is because, again, this is really new science. This was published in 2019. But when I talked about that receptor, remember I said it was a really long name. It's the basically a nicotinic acetylcholine receptor. There are actually articles out there, research that is just barely beginning to scratch the surface, but they're starting to see where this mechanism can help people with movement disorders. So it includes ataxia. It also includes things like Parkinson's and other problems as well. But this is really new science. So I wanted to just show that this is why you might not have heard about it before. The other thing, this is an article that was published in 2018. And again, this is showing that there's research linking the vagus nerve to the development of just about every chronic disease. And this includes cancer, includes heart disease, diabetes, obesity, Alzheimer's, Parkinson's, autoimmune disease. It's really any type of chronic disease. So again, the kind of take home message here is that there is a bidirectional relationship between the immune system and the nervous system. And that's why we wanted to talk about the gut and why it's important to have good immune health in your gut, because it's going to help the nervous system. This slide talks about inflammation. Again, you can see that vagus nerve is going to all those different organs. These are just some symptoms that can happen when you have inflammation that you might not even realize, kind of like that brain fog. You can have dizziness, blurred vision, clammy skin, ringing in the ears, fainting. These are symptoms that are sometimes described under this umbrella called dysautonomia. And so on the next slide, we're going to talk a little bit more about that. These are all symptoms of having weak vagal tone, which just means that your vagus nerve is not working as optimally as you would like it to. And I'm going to just share, I have had every single one of these symptoms. I have had every single one of these symptoms for a long time. And a lot of them got worse last year after my surgery. And this was why I kept thinking all of these things that were happening was just because my colon wasn't working. No, it was because I had more going on than just my colon. So it can cause your immune system to be weak. It can cause poor, slow digestion. For me, even though my colon was gone, my stomach was slow. So I had slower digestion and motility higher up in my digestive tract. Trouble swallowing. This was a really, really big one for me. I told Dr. Brown for a couple years before my surgery that every night when I had to take my pills, I was starting to have problems actually getting the pills swallowed. Like it was to the point where I was feeling like I was gagging and I was regurgitating. And I just had a hard time swallowing pills at night. And I thought this must be psychosomatic. Maybe I'm reacting to the stress of my problem. I don't understand this. And then I found out that actually trouble swallowing, especially like something like a pill, is a very telltale sign of having a vagus nerve problem. You can also have difficulty regulating your heart rate or your breathing. That can be minor or it could be really severe. So all of these symptoms, it could affect people in different ways, and it could be a range between maybe it just happens occasionally, maybe it happens every day. But I had this problem as well. I had my heart rate would start racing. Like, for example, I'm sitting right now, but on some days when I would stand up and maybe walk to the other room and get a glass of water, my heart rate would go from like 60 or 70 up to like 140. It would just start racing.
Angie, can
Horse,
I interrupt you really quick?
sure.
So, and Ken, please correct me if I'm wrong, but a lot of what you're talking about also can help with people that have severe depression and stuff, because the guts and good gut health, a lot of your serotonin receptors are in your gut, correct?
Yes, absolutely. And that's
Okay.
why that the whole gut brain, like whenever people discuss it, they usually, whenever I talk to patients about this, we discuss ADHD, we discuss depression, when you have inflammation in the brain, you deplete your serotonin level and you're in that fight or flight. Your brain sees it as fight or flight, and you will deplete the serotonin and the dopamine. Norepinephrine and epinephrine go up, which then actually it's a seesaw. You need that to go down to actually improve that. So depression is a huge component of this. And you can see that if you're having all these symptoms and you start to have mood disorders and you have trouble sleeping because your epinephrine is up, you're just on a hamster wheel running, and you have to figure a way to get off.
Right. So other symptoms, dry skin, dry eyes, dry mouth, that is all because the vagus nerve controls the glands and all of your secretions, right? So when that isn't working well, then you can have dry skin. For me, I would actually have peeling skin on my face. My eyes were dry every morning. I'm sorry. And my mouth was dry. It was a really big problem. You can also have the next three kind of go together. You can have decreased perspiration, or you can actually stop sweating. You can have heat or cold intolerance, and you can have difficulty regulating your temperature. I had all three of those. In fact, after my surgery, which my surgery was actually a little bit stressful. I had a pretty major surgery, but then I also had complications. I was back in the hospital. And then the whole process was a little bit traumatic for me, both emotionally and physically. So several months later, we live in Texas, and Texas is obviously very hot in the summer. So when it got to be about May, I had an episode where I went to Dr. Brown's endoscopy suite to have some testing done. And I went from, when I got there, my temperature was like 97 to like 101 about 20 minutes later. And it was just because I had a mask on and I was having activity. I had been outside. And so what happened to me was my body, I haven't had sweating in several years. And I had realized that once I read about vagus nerve, that I'm like, oh my gosh, I don't remember the last time I've actually sweat. And I'm also very heat intolerant. So then adding with that the difficulty regulating my temperatures, because my body couldn't cool itself off. So it actually raised my fever to the point where it seemed like I was sick, but I wasn't. So all of these are signs of vagus nerve issues.
Funny story with that. So this is during COVID, and Angie comes in, and I'm scoping somebody else, and all I hear is, one of your patients has a fever of 101. The whole place is infected. And poor Angie's being treated like she's just came off a leper colony because now she's the COVID vector. And I'm like, oh, she's got poor vagal tone. Don't worry about that.
Yeah, it was quite the brouhaha here. Okay.
I insisted she talk about this.
Okay, so we're going to talk about gluten. I'm not going to talk, we could actually spend a whole hour talking about gluten, but I wanted to just talk about a few points before we actually get into how gluten can be important for someone who has any sort of like ataxia or really any kind of nervous system condition. I wanted to just kind of review a couple basics to kind of tell the differences between what celiac disease and what gluten sensitivity is. So celiac disease is actually considered an autoimmune condition. The way you're diagnosed is that you have positive antibodies. So whenever you are eating gluten, your body actually has an immune response to it that they can test through the blood, and they can see that, yes, your body's making antibodies that it shouldn't. It can actually include GI symptoms as well as non-GI symptoms. And the treatment is really just a gluten-free diet, because if you can remove the gluten, then you can remove any of this autoimmune process happening. And it is probably a little bit controversial. It's considered to be rare or less common. I think we all can probably look back over the last 20 or 30 years. If you knew somebody maybe 20 years ago who was on a gluten-free diet, it was probably somebody who told you they had celiac disease. But now, if you hear people who are on gluten-free diets, they might not have celiac. They might just tell you that they have gluten sensitivity, which is a little bit controversial, but I believe it is real. In the literature, they refer to it as non-celiac gluten sensitivity. And this is when patients just will swear that they have improvement in symptoms, either GI symptoms or non-GI symptoms, when they follow a gluten-free diet. And now we know that that's actually possible. It's not just in their head. They're not just thinking that it's doing something that it's really not, because there's actually research that supports that even if you're not making those antibodies that would mean that you have celiac disease, gluten itself can be very inflammatory.
And as we mentioned, under that umbrella, there is something called gluten ataxia. So we do know that people that are sensitive to gluten will produce more neuroinflammation.
Yes. So next slide.
Oh.
So
Did not know that was
one form
coming.
of ataxia is called gluten ataxia. And what I read is that it is a form of ataxia where you have more sporadic symptoms, and it can be because of gluten exposure. This can be either in patients who know that they have celiac disease, they've been told they have antibodies, or it can happen even in people who have been told, no, you've been tested, you don't have celiac disease, there's nothing wrong with you, but maybe that gluten really is causing a problem. And we're going to talk about how that can happen. So gluten can be harmful to the nervous system. And the reason why is because the immune system can mistake the nervous tissue for gluten. So what happens is that when you eat gluten, your body can make antibodies, and it can actually make a lower level of antibodies than what might qualify you as a celiac diagnosis, but those antibodies are still present, or that immune response is still present. But then that immune system being activated thinks that your nervous system tissue is actually the gluten that it needs to attack. And so this brings to the next point: gluten can trigger an autoimmune response. And the reason is because it affects the proteins that regulate how neurotransmitters are released in the cerebellum. So that's one of the mechanisms that's happening. And then the immune reactions caused by gluten can also cause leaky gut, which means that gluten can be more of a brain issue than a gut issue, because when you have leaky gut, you can actually have leaky brain. I don't know if you spoke about that before.
No, we didn't speak about that. In a different lecture, I go into the science of how you can actually, the blood-brain barrier, or the barrier that protects your brain from everything else, becomes permeable and allows more inflammatory things to reach your brain. That's what the leaky brain
Oh,
is.
go back real quick. So one other point I wanted to make. So not only can the immune system mistake your nervous system tissue for gluten, but it can actually also mistake your thyroid for gluten. So again, this could be a whole nother lecture, but there's a disease called Hashimoto's thyroiditis, which is an autoimmune type of thyroid disease. And one of the treatments for that disease is to remove gluten, because what happens is you have antibodies that are being made. They're TPO antibodies. That's how you get diagnosed with that thyroid condition. And what they have found is that if you take the gluten away and you go gluten free, then it can actually lower those antibodies. It can kind of uh, keep that thyroid condition from progressing.
Okay, so now I know where we're going with the talk.
Yes.
And now you've put up with the science part. So
Yes.
thank you everyone for sticking around for that. Now we're going to do the actionable stuff. But I think that the actionable stuff, if you can just think back and go, okay, this is why I'm doing it, which is why I think you have to know a little bit of the science. But now this is the what are we going to do stuff.
Okay. So we're going to talk about healthy eating for ataxia. You can go to the next slide. Thank you. First thing, what we're going to do is just go through some of the nutrients that are really important. A lot of these you probably heard about. I'll try to give a little bit of information about them. Omega-3s, I'm sure you've all heard about. They're very good for the brain. They're very neuroprotective. They're also called DHA and EPA, or those are actually two of the types of omega-3s, but those are the ones you see a lot when you're seeing any kind of information out there about omega-3. Omega-3s lower inflammation. It's really important because it also helps the cell walls be healthy. So the foods that you see here, eggs, fish, nuts, avocados, olive oil, some of them, especially like maybe eggs, you think of, well, gosh, maybe eggs raise your cholesterol. Actually, cholesterol you need because it's part of your cell wall. So that's where that kind of ties in. But omega-3s are very good, and recommend eating them every day.
One quick, well, we'll talk about that in the supplement portion of it.
Okay. Choline. So again, your body cannot take acetylcholine. Like you can't buy a bottle of it. But choline is one of the nutrients that your body needs to make the acetylcholine. So these are some sources of that. Again, it's some of the same ones we talked about on the last slide: eggs, lean fish, nuts, cauliflower, and broccoli. All of those are very important sources of choline. So that would be another nutrient to kind of pay attention to.
Go ahead.
Question: what
Yeah.
kind of, are there specific kind of nuts that are helpful, like almonds? Like, are there certain ones that you should focus on, or all nuts?
I think almonds are very healthy. Walnuts are healthy. Obviously, when you go to the store and you buy the can of the salted cocktail peanuts, you might get some benefit, but it's probably not the best. You're really probably looking at like the raw nuts, right?
Yeah, you know, that's a great question, Linda, because even the nuts, when you look at it, a lot of those mass-produced nuts. I just had this person on my podcast. Her name is Kristen Villemure, and she just wrote a book called Biohack Your Brain, and she's got a whole section on this. She studies concussive issues with NFL players, and I'll look and see if she specifically says that, but that's a great question. And Angie's right that if you read the label on these, you'd be surprised how much high fructose corn syrup is in some of these mass-produced ones, and how they use soy oil and things like that that you're trying to avoid because those aren't there. But
yeah, but almonds and walnuts are always really good, especially like the raw. So you see a lot of articles where there's just so many benefits to those types of nuts.
we'll figure that out for you.
Yeah. All right, vitamin D. So vitamin D is like my favorite vitamin. I talk about vitamin D all the time. Vitamin D is not just a vitamin, it's also considered a hormone, and it's so important. You guys probably have heard vitamin D is the sunshine vitamin. That's because your skin can actually produce vitamin D when it's exposed to the sun. So this is where getting outside and having that time outside can actually be very healthy. Vitamin D is really important for your immune system and your nervous system. And it's really very common that people are deficient. In fact, every single time I get lab work, I'm always telling Dr. Brown, check my vitamin D level because I'm really obsessed with vitamin D. One of the really cool things that I learned when I did my nutrition masters is that vitamin D actually works together with vitamin A. So what happens is vitamin D has a receptor. So we talked a little bit about receptors earlier with the acetylcholine receptors. So your cells also have another receptor that is the VDR receptor. And that is the receptor that you need vitamin D to activate it. But then that receptor is what is going to do all the good things in your body that vitamin D does. But that receptor actually doesn't just need vitamin D to activate that receptor, but it needs to join with the vitamin A receptor as well. So it works together. Vitamin A, we're going to cover that on the next slide. It's also called retinol, and the VDR and the RXR, which is the vitamin A receptor. They have to join together, and that's how you get the benefits of both the vitamins. So one of the really cool things we learned in my master's program is that you can see, first of all, links between every type of chronic disease, whether it's heart disease, diabetes, autoimmune, cancer. You can see links between those disease developing and people having lower vitamin D. In fact, there's articles that are even being published that people who have autoimmune disease, there's a higher prevalence when you are in climates where you don't get as much sunshine. So vitamin D is important for your immune system to function. You need vitamin A for it to all work together. And vitamin D is in fish, red meat, liver, eggs, and cheese, just a few of the sources.
Miss Linda, so according to Dr. Villemure, who is a neuroscientist and strictly works on neuroinflammation, walnuts, almonds, cashews, Brazil nuts, sunflower seeds, hemp seeds, pistachios, pecans, pumpkin seeds, macadamia nuts, hazelnuts, chia seeds, pine nuts, and peanuts. Specifically, she says that walnuts are a brain superfood, with research showing this nut can improve neuron messaging, preserve and boost memory, reduce inflammation, and trigger neurogenesis, or brain cell growth.
I'll be buying walnuts later today.
Right?
There you go. Okay, so vitamin A, again, it's called retinol, and you need it as well for the nervous and the immune system to function. And like we just said, it works with vitamin D. One of the really cool things about vitamin A is that, well, it's cool if you understand it. It's not cool if it's happening. But so if you guys want to try a cool kind of experiment later, if you're curious, if you go out to Google, there is something called a chicken skin rash. And you guys have probably all seen it before. It's like a rash that you can get usually like on your upper arm or maybe on your legs. And it kind of looks like chicken skin. It's got like little red bumps. So when you Google chicken skin rash, you can see that there are that same image. It's being used in articles that talk about vitamin A deficiency and articles that talk about gluten. And the reason is because gluten can create inflammation that can make you deficient in vitamin A. And the reason that's super important is, again, because if your gluten is causing inflammation that is lowering your vitamin A, then you can have all the vitamin D you want. Your doctor can test your levels and it can be really high, but your body's not going to be able to use vitamin D unless there's vitamin A. They have to work together. So the good news is that you see vitamin A in a lot of the same foods that you see vitamin D. It's, again, in these cheese, eggs, fish, milk, yogurt. A lot of these types of foods all have both of them. Vitamin E is just really famous for being important for your nervous system. So I wanted to include that as well. It's found in green leafy vegetables, nuts, seeds. So again, it's going to be those healthier nuts that he just mentioned, like almonds, walnuts. I think you said pecans, pumpkin seeds, things like that. B12 is really important for nerve function, and this is one that you're going to find a lot in meat and any kind of source of protein: fish, meat, poultry, eggs, cheese, milk. All of those are really important sources of vitamin B12, which is also important for your nerve function.
Being that this is the Nebraska Ataxia Society, I think that they're all sufficient in B12.
Probably. And just a cool fact, I'm actually from Iowa, so I'm your neighbor. B5. B5 is also called pantothenic acid, and it's actually needed as well to make acetylcholine. It's one of those nutrients your body needs. So it's really important for nerve function. What happens is that B5 is actually called a cofactor. So when you have chemical reactions that are happening in the body, you have different molecules that are needed, and some of them are called cofactors, which are molecules that just kind of help that reaction happen. And B5 is an important cofactor in how acetylcholine is synthesized. And again, you can find it in fish, meat, poultry, but you can also find this one in peas, green leafy vegetables, lentils, things like that. I almost think I need to let Dr. Brown talk about this slide.
I gotta take this one. Okay, so polyphenols. If you have not heard of what a polyphenol is, it is actually the molecule that makes fruits and vegetables very colorful. In fact, it's probably, if you eat a vegetable, including the vitamins that you get with it and the insoluble fiber, which helps you go to the bathroom, the most powerful effect are these polyphenols. Now, this is something that a lot of people are just now starting to talk about. I happen to be very passionate about it because my research in the whole thing about helping people with IBS is I developed a product that has been a sponsor of the Nebraska Ataxia for the last several years. But that product is a combination of polyphenols. And what these polyphenols do is that when you eat them, they get broken down by your own microbiome, meaning you have these organisms that live in your colon that help you live a better and healthier life. And one of the ways is by breaking down these polyphenols. They get broken down into smaller molecules that then get absorbed, that then do all kinds of amazing things. The science is pretty deep on this. For example, some polyphenols that you've probably heard of are resveratrol, quercetin, turmeric, curcumin, ginger. These are all polyphenols. People aren't talking the science of that. Green tea. Yeah, green tea extract. And the one that I use is called quebracho, which is one of the largest, most stable polyphenols that gets actually broken down by your microbiome into quercetin, green tea, and all these other smaller ones. So you're going to see a lot of information on this. When I interviewed Dr. Villemure on Wednesday, she's got a whole section on where she talks about polyphenols. She references a Harvard study where people that ate blueberries every day, over a period of time, they decreased their neurologic age. So their brains got younger. And what's in blueberries is a polyphenol called a proanthocyanidin. So I'm of total belief that we are not getting enough polyphenols. In fact, I was watching a podcast with Michael Pollan, who's an award-winning author and does a bunch of movies on Netflix and stuff. And he said, what's really sad is the typical American gets most of their polyphenols from tea and coffee, and they are lacking the real benefit of all these things. So colorful plates means you're taking in some polyphenols. It's my passion project.
Okay.
So as always, we want to try to live. Supplements are there to supplement your health, not to completely get rid of a proper diet. You can't go to McDonald's every single day and then hope that you can take some supplements. So I personally take an omega-3 fatty acid with a high DHA and EPA. I do this because I just want to make sure that I'm getting enough. Now, if you look at the data, Linda will say, yeah, but they're talking about how it's not good for it's not as good for your heart as what we thought, but we know it's strongly neuroprotective. And in fact, in Dr. Villemure's research, she uses a really high amount, like most that people can't get enough. She says you almost can't get enough in there because your brain uses it, especially when you have something going on in your brain already. Her research was on CTE, but if you've got something going on in your cerebellum, you need to give it as much as you can. Once again, the polyphenols, if you're within shouting distance of me, I'm telling people to take polyphenols. I just fortunately happen to have a product that has one of the largest and most stable polyphenols in it. So, and the full disclosure, of course, this is, that's, I own that. So that's, I'm not saying go out and that's the only one, but that is the one that I recommend because I know the science behind it. I'm going to let Angie talk about Huperzine A.
Yeah, so Huperzine A is one that I discovered last year. It is an herb and it actually blocks the enzyme that breaks down acetylcholine. So, again, we talked about how it was just so important to have your acetylcholine levels. Um, a lot of things that cause chronic inflammation and chronic stress in your body will actually cause this enzyme to break down your acetylcholine before you can use it. So this um, herb actually blocks that from happening, so that therefore you just continue to have acetylcholine without it breaking down too early. For me, it was a game changer. So I started taking it about a year ago, and that's when I was having a lot of dysautonomia. And like I said, last year we had that story in May when I showed up at the endoscopy center and my fever went to like 101. And then that happened again. So, like, we were in COVID, so I wasn't really leaving the house a lot. I have a job where I can work from home. But then in June, I thought it's summer, let's go to the grocery store. We went to the grocery store a few times and my fever just skyrocketed and I ended up with like whole body pain, felt like I had the flu for about 24 or 48 hours. So basically I spent all of last summer in the house. I couldn't go outside. We live in Texas. It was extremely hot last summer. This year, I am able to tolerate the heat. I've been able to start walking again in my neighborhood. I still am heat intolerant to a certain point. I can't stay out just unlimited, but I can stay out for about 30 minutes before I start feeling like, okay, I'm starting to get the signs that I need to get inside quick. So it's been a game changer, and a lot of the other symptoms I had as well have improved. I actually found articles, I sent them to Dr. Brown, that one of the molecules that's in Atrantil actually helps Huperzine A work better. So I actually found that just in the last day or so and sent that to him. So those two are really good to take together.
Linda?
Angie, I actually take almost all of these supplements myself.
Mhm.
I do not take Huperzine A. Where do you get that?
You
Where do
can
you buy
find,
that?
you can, I found mine on Amazon, to be honest with you. The one thing I will say is that it comes in different dosages. So I myself take a pretty high dosage, but I do know other patients of Dr. Brown's and friends that take a much lower dosage. So I would recommend looking for a lower dosage. I think it's in a lot of combo products. If you look for like products that are supporting the vagus nerve or the parasympathetic nervous system, it's in a lot of those products. You'll see that. It'll be paired with some of the ones that we have on the next screen. But when it's usually in combination, I'll see it like 50 milligrams. I think that if it's by itself, the lowest I've seen is like maybe 200. I actually take 400 and I take 2 of them every night. So
It's currently being, I know that there's ongoing studies right now looking at Alzheimer's dementia, looking at Huperzine A. So this is starting to become well known in the neuroscientific area.
yeah.
Vitamin D, as she had mentioned, most of us are probably vitamin D deficient. Really, it's ideal to look for vitamin D3, which is the biologically active form. Magnesium threonate. Surprisingly, as I check my patients, especially their red blood cell magnesium, many of us are magnesium deficient, and people go out and they just see magnesium and buy it. The issue is that there are different forms of magnesium. Magnesium threonate happens to be the one that's great for the brain. It's a really good one to decrease inflammation. It gets absorbed readily and crosses the blood-brain barrier, and it really helps with sleep and inflammation. There are other types of magnesium like magnesium citrate and oxide. They are poorly absorbed, which is why they work like laxatives. And spirulina, it's from algae. I like spirulina because it's kind of got a little bit of everything. It's got DHA, EPA, and it's got a lot of amino acids and some trace minerals in it. And it's dirt cheap and probably something that we should all be taking. All right, this is next level supplements. So I'll let Angie take this, but this all gets into, this is why you had to understand all that science before, because
Right.
if we were to sit there and if I were to sit here and say, okay, what would be the perfect brain protective pill for anybody with ataxia? I think it would include everything that we're talking about, but okay.
So alpha GPC is another supplement that I sometimes take. It is actually considered the best form of choline to raise acetylcholine. So again, you can't just take a supplement of acetylcholine. Your body has to make it. Your body needs the right nutrients. It needs choline, and this is the best form that is the most like biologically available that you can actually get. Acetyl L-carnitine is a supplement that it's similar to acetylcholine, but actually what it does, it's a little bit unique. It actually binds and activates the acetylcholine receptors. So it's kind of like a supplement you can take that'll make those acetylcholine receptors work a little bit better. B5 we talked about on the other slides. Again, it's a cofactor that you need to help make acetylcholine, so it's important. B5 is also called pantothenic acid. And then in acetylcysteine, I'll let you talk about that one.
N-acetylcysteine, NAC, is an interesting one because in the literature, it discusses how it's used to make something called glutathione, which is a potent antioxidant, and it actually regulates glutamate, which is a neurotransmitter for nerve signals. I have been involved with N-acetylcysteine for a long time because I discovered that it actually, so this is, I'm not encouraging this, but if you drink alcohol, it actually helps metabolize the toxic part of the alcohol, the acetaldehyde, into something you can pee out. So it helps protect your liver and brain from the damage of alcohol. So I grew up in Nebraska. I know a few people like to drink once in a while. It's okay. So if you're going to do it, I actually recommend making sure that you take N-acetylcysteine. And a lot of other research is going into using this for Alzheimer's and for CTE. And I'll let you talk about Vincopetine. Vincopetine?
I have a question about the, you said it's used to make the glutamine or glutathione. I actually take glutathione or use glutathione patches, but is this better for me to actually do the precursor that's going to make it?
So that's an interesting thing. So a lot of times people will look at this and they'll say, oh, we have an opportunity to, this is part of the problem with the supplement industry, is that people will look at this and, like Angie's saying, oh, you can actually buy acetylcholine. Like you can buy a lot of these things. Does it actually get absorbed? Does your body destroy it? Are we sure that it's being absorbed? I don't know. So I would love to see the data on glutathione patches and how much it raises it, and is it being raised in the right area? For instance, looking at the science of the polyphenols, when you take in turmeric, you don't absorb the turmeric. You need it to go to the colon where it gets broken down. The polyphenols then, when some of the neurotrans or some of the breakdown products that they do, like urolithin, but it also forms BDNF. BDNF goes to your brain to help your brain repair neurons. I've looked on Amazon and you can buy BDNF. And I'm like, no, it doesn't work that way. So it's a really sticky area. And when you dig down into the research, oh, and speaking of that, obviously I'm a physician, Angie's a nurse. We're making these recommendations, but as always, there has to be that caveat of saying, please discuss this with your doctor. Knowing that I get a lot of people that come to me, like that's why, Linda, I'm surprised that you're on a lot of these things. I'm impressed by your doctor that's at least embracing some alternative things. A lot of times people will go to their doctor and be like, well, what do you know about, say anything. And they'll be like, oh, well, there's no science on it. And that's where Angie and I come in. We've got a Mendeley account, which is a repository of literature that is just, what, 30,000 articles now?
I'm close to, yeah.
30,000 articles based around brain gut things.
Yeah.
So I love it when another physician is drinking a Coke and eating a Snickers and saying that there's no science on what I'm talking about, like the polyphenols. So anyways, get back to the...
So,
Yeah.
a real quick question
say,
also
Go ahead.
on the acetylcysteine or whatever that's called.
Uh-huh.
So you say it regulates glutamate. So SCA1, which is what Linda has, the problem is with SCA1 is the body creates too much glutamate. and that's what's attacking her cerebellum. So does this reduce the amount that the body creates, or?
It's actually a precursor, so that's a good point. And I mean, that's where I think anyone with any kind of nervous system, if you're going to try a supplement, it's always recommended to start with the lowest dosage. See what
Sure.
works. These are just a starting point. a- there's a lot of trial and error to see what's going to work for you and what's going to be best and how your body's going to react. I was going to say about the glutathione, the one thing I do know, I don't know anything about the patches, but the one thing I do know is if you take it orally, I have heard that the best form is a liposomal glutathione. So you can get those like in either like liquid, or I actually have some that come and they're like in a soft gel, which I will say if anybody on here has gut issues, any supplement you can find that is more of a soft gel is going to be easier absorbed than one that's like a hard pill or capsule tablet, something like that. Okay, so the last one, I'm sorry. Is there a question?
Well, so with the glutathione, it's ridiculous. I take a pill, use the patch, and I go to the doctor and get IV infusions of it.
Okay. Yeah.
Anyway.
Oh, but I was also going to say, in a logical form, it kind of makes sense that you want to encourage your body to make the things that it can instead of doing the supplements, right? If you can encourage your brain to make those supplements by, using the one that caused it, it probably has to be a little bit more effective than just taking the supplement itself.
Yeah.
So yeah, Elizabeth, that's a really good point. And so Skippy, regarding that it's used. So I'm not an expert on the glutamate aspect, but a lot of these things, when you allow your body to do what it wants, it can regulate it, just like she's saying. So it's not necessarily, it has the ability to increase it or decrease it as needed. That's why giving your body, ideally in a whole food way, your body will figure out what to do with it. When you force it, an example will be that in the pharmaceutical industry, many times they will take, let's just use melatonin, for instance. They will take a known natural compound, but they cannot patent that. So they will take what they consider the small molecular aspect of it, and then they'll turn it into a drug and remarket it as something else. And we tend to see tons of weird side effects, nausea, vomiting, things, and it's not as effective. The larger precursor, if you are leading a healthy lifestyle, and we'll get into that, then your body will be able to use what it needs and regulate it. All comes into everything's balance. So
the last one is the Vincopetine. I'm not sure if I'm saying that right. It improves brain circulation. I know, Linda, you actually told Dr. Brown you were on it. So we looked it up and I'd never heard of it, I will admit. One thing I did read is that it increases eNOS, which is your endothelial nitric oxide. And nitric oxide there's several different types, but that's the good one. Oh, sorry. And it also helps increase acetylcholine. So you want to talk about
just
nitric oxide?
Super quick on the eNOS, what that is you have nitric oxide synthase, which converts arginine to nitric oxide. Specifically, it increases the endothelial, which what that means is you increase blood flow to your brain. Nothing you're doing is going to matter unless you have good blood flow to the area that needs all these nutrients. And we realize that the brain, I forget the stats, but it's like it takes up more glucose and blood flow than any other part of the body because it requires so much. So this helps increase the circulation to the brain.
And then the last slide is just a reminder that, we've talked about nutrition and supplements, but it's really all about your healthy lifestyle. There's a lot of other things that affect your levels of inflammation, not just what you eat or what supplements you take, but, you want to make sure you're getting good sleep, being outside, being active. I put the slide or the picture in the middle because there's a lot of data also that the social interactions you have and the relationships you have with people, those actually, to speak to the point about the depression, that actually helps your body kind of, what am I trying to say? It helps your vagus nerve, but it helps your vagus nerve function because when you're happier and when you're more connected, then you're in that more relaxed state. Your body's not constantly trying to fight the stress.
study came out that showed that loneliness is more deadly than smoking a pack of cigarettes a day.
And I also was just going to end with, I brought a book. This is, I don't know if you guys can see this. This is a really, really good book. If you guys want to read more about the vagus nerve, this is not a very long book. It's pretty short. It's very easy to read. It covers a lot of great information. I really highly recommend this book. And then,
Hold on.
Angie, if you share that with Linda after this via email or whatever, we'll put that
Sure.
link.
We'll go ahead and share that. But I want to comment on the other two pictures because they're equally important. Number one, the sunlight does represent converting vitamin D, but more importantly than that, your pineal gland helps regulate your circadian rhythm. So neuroscientists like Andrew Huberman do a lot of research on this. Your eyes are essentially an extension of your brain. Don't even consider them a different organ. Your eyes take in the neural signaling and goes straight to the brain. He has shown that if you can get up and actually get actual sunlight in the morning, for depending on the amount of sunlight, not through the window, not with sunglasses on, actually get outside, you can trigger your pineal gland to start the circadian rhythm, which actually sets off this whole cascade of anti-inflammatory processes. Doing it outside, doing it while on a walk is being even better because the exercise increases BDNF, that thing that I talked about that decreases the brain inflammation. And then if there's one hack that I tell all my patients, if you can focus on one thing, make sure you have a good sleep hygiene. While you sleep, you're surprising, there's actually a lymphatic system in your brain called the glymphatic system. And that is where, while you sleep and get into the different stages of sleep, that you clear your brain's toxins and beta proteins and tau proteins and things that build up. So the sleep is so important. And it's so important that I don't want it to become stressful when people can't get it, but it's really important. Some of the things that aid in the sleep, while you sleep, that's where the BDNF helps you get into deeper sleep. And I actually have wicked dreams, fun dreams, when I take Huperzine A. Yes, so something's going on there also. I think it has something to do with the connections. So really cool dreams. And I think
that's it.
Okay, I got one more slide and then we'll go over the books.
Okay.
So I want to thank everybody for joining here. Mostly, I really want to thank the mouse called Linda, because without the mouse called Linda, we would not have Linda and Skippy setting this up, and she would never have started the Nebraska Ataxia Foundation. And I really want to thank her for all of her dedication to this while still battling the same disease and keeping it together and helping everybody else. And Linda, I showed the Zihuatanejo picture because what I realized what you're doing is you're bringing hope. And Angie showed that there is now new research ongoing, looking specifically at ataxia, looking at the vagus nerve, looking at how to modulate acetylcholine. So the Zihuatanejo from Shawshank Redemption, the movie, obviously, the last line, it's that hope is a good thing. And so that's what we believe, that everything that you're doing is bringing hope. And hopefully, with all the research and stuff like this, maybe you learned a little bit today. So do you want to show the books real quick and then we'll take questions?
Okay. Again, this was the book. It's called Activate Your Vagus Nerve. I'll send the information. This book I love. It's called Why Is It My Brain Working? It's a big book. So if you're not a reader, probably not for you. Bought the book for Dr. Brown.
I will get to it someday.
Yeah, I'm going to hit him over the head with it. It's got a lot of great information. I really highly recommend it.
Did you have others that you wanted to show her? Oh, I got one. Linda gave me one of those books. Hand me the bottom one. She'll know this one.
Yeah, I saw this on one of their videos. The
Wall Protocol.
Yeah.
And then one that I just read this week because it's brand new, and it's a good read, and almost everything we talked about is in here, but it's in reference to just overall brain health. It's by Kristen Willemure. Just go to her website, kristenwillemure.com. And this is really good because it talks about diet recommendations and explains it in a very layperson way. So
Yeah, I will say this book here. I don't know if you can see, and I'll send the information, but this author, his name, I can't even say. His last name is Karazian. First name is Datis, Datis. Don't know if I'm saying that right. He is really, really smart. He has a website. He has a YouTube page. So if you want to just find him online, you can find a lot of his information that way for free. What else was I going to say about that? The gluten information. Very good explanation of that in here as well.
okay, that was a lot of information. I'm sorry if we bored everyone, but it kind of felt like all that was necessary. Does anybody have any questions?
I hope it was helpful and not too geeky.
It was wonderful. Thank you.
We could probably unmute now so that if anybody has any questions, we can just have a discussion if you want, or if not, we'll.
A lot of good information to absorb.
It is a lot to absorb.
Yes.
I took a lot of notes. Thank
Well,
you.
It is being recorded, so you can go back and take a look at that. And if there's, both Angie and I are pretty accessible. If
Yes.
there's if you have any questions or you're concerned about anything, and this is a moving target for everyone. This was gonna be a much simpler lifestyle talk, and then it just kept evolving into, oh my gosh, this is coming down to a lot of the stuff that we discussed needs to be out there more for physicians also.
And if you have any questions, feel free. I mean, Dr. Brown knows how to get in touch with me, and I don't mind even just picking up the phone and talking sometimes. So I do that with a lot of different people. I'm in a lot of support groups for my issues online, and I enjoy just talking with people, and we learn from each other. Did we lose people?
I don't know. Skippy, do you have anything to add?
I just got a text from Linda
I don't see them
who
on.
says, we don't know what happened to the internet. We're trying to figure it out.
Oh, no.
So perhaps they've been disconnected. I'm not sure.
Maybe they should try some N-acetylcysteine and see if a little glutathione will get that Wi-Fi back up and running.
Yeah.
Hey, the internet at the coffee shop we're at went down, so sorry about that. So I don't have anything else to add. I don't think Linda did either, other than Angie and Ken, thank you very much for your time. We certainly appreciate it.
Absolutely. It's definitely, I learned a lot preparing for this. So, and I just, want to commend everybody that's a part of this group, and we will continue to be sponsors, and hopefully as a team, we can find something to help everyone, no matter what type of ataxia you have.
Right. And I just want to encourage you. I mean, all of the information is helpful to kind of understand why things happen when you have a lot of different symptoms. For me, it's helpful to understand kind of the reasoning of what's happening in my body, and it gives me some ideas of different things I can do. But nothing, I mean, I don't want to come across as saying, none of this is actually going to take away any of the problems, but it'll help make it to where maybe some of the symptoms aren't as severe, or maybe even prevent things from becoming worse had you not known some of the things that you can do to support your health. For me, I mean, I still have issues. I still have gut issues. I still have dysautonomia issues. But the more I've learned, the more it's been able to help me find things that work for me to make my symptoms more manageable and less severe. So I just want to say that as well.
And then when Linda and I talked, when she described having good days and bad days, that's a way to at least wrap your brain around it while you're having a bad day. Oh, I didn't sleep well. Oh, I had a pretty, I didn't eat very well yesterday. That can have that short of an effect. So you don't beat yourself up and you go, okay, this is not my disease getting worse. I've got a bad day. Tomorrow will be a better day because I'm going to make sure I sleep and eat well, and so on and so on.